moment, you ask them whether they allow you to actually do their patients, right? They probably will tell you, oh, that's great, you know how to do passive range of movement. They will actually suggest to you which of the patients might benefit from the passive range of movement. Then maybe in front of them a few times, you know, you show them and see whether they have given you some instruction. Just like, for example, the whole time, the therapist probably can tell you in terms of the condition, should it 5 seconds, should it 10 seconds, they will know better, because sometimes for some patients, the tightness is so great that you really need to hold 10, 15, even 20 seconds, alright? So I encourage you to go back and demonstrate, to do it. Okay, so imagine that we have a patient here and that she is bed rest, and then she probably start to develop some contraction, you know, like that. Then maybe one side that she have a stroke, she's like holding tight, you know. Whereas this one, because it's not moving, also start to develop some tightness over there, things like that, lah. So Mr. Tay will be the therapist. So when you come in, the patient don't know what you are going to do, because suddenly you say, you know that they don't know what are you going to move me. So normally we have explained to the patient, what's your name? Lei. Okay, so today we're going to do some exercise for you. It's actually to help you to loosen up some of the stiffness of your joint. I'm going to move your upper body into a certain range, and if you have any pain, you just let me know. Depends on your patient responsiveness. Some of them you just need to explain to them and see whether they understand, or whether they start to feel a bit, you know, the ease of touching them and things like that. So if the patient has a question, you answer before you start. So tell your patient always what is expected, okay? And also something like consent. Okay, is that okay? It's like, you know, give them a choice of a sense of autonomy. Okay, all yours. Yeah.
Miss Claire, how are you doing today? And the therapy assistant, when you do some exercise, you sleepy.
To increase replace her sleepiness, is it?
Shall I do some exercise?
Excuse me, I suggest you stand the
Okay,
so that we can see.
Yeah, you can act a bit, some tightness, okay? But be kind to him also.
You are going to start now, okay? If you feel any pain, let me know, okay? If you don't handle or any pain, just let me know, okay? So now, bend your elbows towards you, okay? So you do it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You do it for 10 times. Okay? So far, okay? 2, 3, 4, 5, 6, 7, 8, 9, 10. Then proceed with the next exercise.
Okay, alright, maybe I add in a little bit. So, for example, for the elbows, you know that there's 2 directions we can do. One is into the flexion, one is into the extension. So what just now Mr. Tay had demonstrated is, let's say if this patient have been always in extension, so which means that this patient decrease range into flexion. So the emphasis is to increase the flexion, hold for 10 seconds. Well, vice versa, if let's say this patient stroke, okay, she is always in flexion, my emphasis would be more to open up, and then she have tightness, right? When she have tightness, then I can only do it very slowly. Just like now, she's actually holding me, and then I will see whether she have pain, or sometimes she don't have pain, sometimes it's just the muscles automatically have the spasticity. Okay, remember the key or rule is that it shouldn't be discomfort. A bit discomfort is okay, but not like greatly discomfort or a lot of pain. Right? So if she has pain, let's say she, I will just hold that. I'll just hold that. And then another thing is that for just now, she hold at the distal. Okay, this is also one key point that we don't hold at the distal. Okay, imagine she is very tight here, and this is very loose. What I will do, I will do this. Okay, I will stress on the wrist joint. So always, if you find that you have to move the elbow joint and there is another joint in between, hold at the joint area so that I can move the whole piece. Otherwise, I can just like even worse like that lah. So hold at the wrist area, like stabilize at the wrist area. Then you hold. Let's say, okay, she have a pain there. I hold for 10 seconds. She start muscle, and I can, when my hands is here, I'm stretching the bicep. A good thing is your hand can feel whether these muscles loosen up. So loose already. Okay, then I can go a little bit more. Then a bit of tightness. I hold for a while. So sometimes I say why 30 seconds. Sometimes can be even 1 minute. Depends on the patient condition. I might need to into phrases in order to achieve the end of range. Then at the end of range, then I hold and see whether the muscles loosen up and whether she's happy there, she's not crunching her teeth. Okay, then I'm done. So you will say that, okay, if I emphasize on opening up, how many times should I do? The notes normally say 5 times, but if you are spending almost like 2 minutes in just one joint, you see lah, you have this one to do, later you got leg to do almost 1 hour, then maybe sometimes I do only 2 times, you know, so it really depends. But if you have the one that's relatively easy, just opening up, okay, 1, 2, 3, 4, 5, 10, and then you can do 5 times. Okay, we try the shoulder.